Dr. Gupta, Harsha, thank you so much for joining me today.
It's a pleasure to be here. How are you?
Fantastic. So tell me a little bit about how AI is used within Florida Atlantic's healthcare system.
I'm an adjunct professor there, and right now it's actually a very unique opportunity because we're building out a practice plan for the university. And I have a little bit of a role in that. And in my private practice, we are doing strategic rollout of artificial intelligence, in the different algorithms for taking care of making some of our clinical decisions. And so we want to be able to put the basis there in the private clinics, and then be able to coordinate it from a health system perspective as the clinics grow out in the Florida Atlantic system.
Absolutely. And then you actually were a part of implementing the AI within the healthcare system, right?
Right.
So can you tell me about some of the challenges that you may have faced, and then possibly how you overcame those challenges?
At Florida Atlantic University, we work with a lot of devices and clinical trials. We have a clinical research unit. And the most important challenge is secure healthcare systems. We all are implementing clinical decision support systems, but on a verge where you connect the whole system to electronic health records and you connect it with the database, you need to be more secured so that the whole process is more, the framework is more, FDA, it's into a process of FDA approved, frameworks. So that's the most important challenge. And overcoming this challenge, we have our team develop certain amount of algorithms which secures the whole framework and the network system. And we have our whole team on an everyday basis monitoring and supporting the professors, the medical doctors, and the clinical supervisors in the whole team. So that's the first thing. Second, to work with the patients, we are trying to more, having people with a social and economic background, so we can connect with the patients more, understand, what their, regular medications are, what their issues are, and then we could have the best use of technology to address those issues.
And so how are you actually using it within medicine? What type of AI is being implemented?
So for example, I do robotic knees and hips, and we're using navigation systems to do our surgeries. So we look at maybe the good knee, the knees that's not being operated on, implementing data sets and acquiring information for how that knee works. And then as we replace the damaged knee, then looking at that data points and then streamlining it with the robotic applications of replacing the damaged knee. So that's a small example. Another example would be I'm a sports doctor, so performance athletes, when they come in and they tear their ACL or they tear one of their ligaments and we operate on them, some of those patients, we have some data sets where we know what their pre-performance levels were, and then we try to match those pre-performance levels with the surgical applications and then the rehab applications. So, that's a good example.
Yeah, it sounds like it's really beneficial too to utilize that technology in that case.
Yes, because I think it gives the patient, in my sense, the athlete, that ability to kind of self-direct their recovery to the level that was pre-injury level.
That's very important. Dr. Gupta, Harshal, thank you so much for joining me today. I really appreciate it.
Thank you.
Thank you.